Hi.
Hi.
Come on in.
Hello, my name is Tammy. I am a student nurse practitioner. Are you familiar with nurse practitioners at all?
Yes, I am. My aunt is one.
Okay. Good. I work with Dr. Jones here, so I will assess you and treat you and prescribe medications as needed.
Okay, thank you.
All right. Can you begin? What brings you to the office today?
Well, I have this rash that it started about 2 months ago on my upper thighs, and it's just getting bigger.
Okay. And you noticed this how long ago?
About 2 months ago.
Okay. Anything happened 2 months ago that...
I went on spring break in Florida, and about a week after I got back, I noticed it.
Okay. Let's see. Do you have anything that you've noticed on your skin? Like, is it itch? Anything red?
Yes, it's red, it itches. And I noticed that my roommate also in my dorm room has some red spots on their arms and chest.
Oh, okay. Have you been using anything to help with this?
Yes, hydrocortisone cream. It helps relieve this itching just temporarily though.
Okay. It hasn't gone away or anything since you've used this?
It helps it just temporarily.
Okay. Now, you said your roommate has this. Do you share anything with your roommate at all?
Yes, sometimes we share clothes, and we also launder our clothes at the same time.
Okay. Have you noticed any fevers at all?
No fever.
Okay. Any kind of new soaps or anything you've been using to wash your clothes with?
No, nothing I can think of.
Okay. Your roommate hasn't been using anything either, anything new to wash your clothes with?
Not that I know of.
Any lotions that you've been putting on that's new, out of the ordinary?
No.
Okay. Anything at work or at school in your environment in your dorm room that is different that you've been exposed to?
Not that I can think of.
Okay.
I did when I went on spring break. I swam at the beach and sat in a lot of hot tubs with these same roommates and college friends.
Okay. All right. Do you have any allergies?
No. Actually, I forgot. Yes, I have 2 allergies, penicillin and sulfa.
Okay, and do you know what your reaction is when you take these medications?
Just a mild rash.
A mild rash. Okay. Any medications you're currently taking besides the hydrocortisone cream?
No.
Okay. What about some past medical history? Any surgery that you've had?
No.
Any trauma that you can remember?
No.
Any chronic diseases you have?
No.
No. Anytime you've been in the hospital for anything?
No.
No. And are you currently treating yourself for any kind of problem?
No.
Okay. Any family history? Do you have, does your family have a history of like skin sensitivity or any problems with their skin at all?
No.
No. Any allergies that your family members have?
Nope, not that I know of.
And what about asthma and breathing difficulties?
No.
Okay. All right. So you are a college student, and I have here that you're a 19-year-old male college student. What year are you in?
I'm a sophomore.
Sophomore?
I play. I came to college because I got a scholarship to join the wrestling team.
Oh, good for you. Okay. Are you in any relationships at all?
Yeah. Not really. I just gotta stay single. I'm too busy with wrestling.
Okay. Are you sexually active at all?
Well, if I am, I use a condom.
Okay, all right. Do you have any pain, any joint pain or edema anywhere? Edema is swelling to your extremities at all? No. Okay. Any nausea or vomiting?
No.
Are you tired a lot? Any excessive tiredness? Anything that you've noticed?
No.
No. Okay. What about your breathing? Any shortness of breath at all?
No.
No. Chest pain? Any chest pain
No.
anywhere? No. It doesn't hurt when you take a deep breath in or out?
No.
Okay. Any swelling that you've noticed in your lymph nodes in your neck or in your armpit areas or anything like that? No? Okay. Let's see. So you said you went to Florida for a little while ago on vacation. You were in hot tubs a lot. Now, are you using any kind of recreational drugs like heroin, marijuana, cocaine, anything like that? What about alcohol? Do you use alcohol?
No.
No? Okay.
I don't smoke either.
Okay, good. What about steroids? Have you used any steroids at all?
No way.
Okay, good. Are you familiar with steroid use and
Oh, yes.
Good. All right. Do you have any questions about that at all?
No, but thanks for asking.
Okay, good. Okay, so with that said and done, I'm going to take a peek at your rash that you had mentioned, and I'll also go over and listen to some other things like your heart and lungs. I see that the medical assistant was in here a little while ago and took your vital signs before I came in. Your blood pressure was good. It was 128/68. She also took your height and your weight, and your temperature was good too. It was 98.8, so no problems there. So I will begin by listening to your heart and your lungs, okay? Normally I would have you in a patient gown and then just listen to your skin, okay? But right now I'm just going to listen to you the way you are. Well, listen to your backside first, okay? All right, if you can just take a deep breath in for me. Good, and another one. Great, another. Deep breath in and out. Good. Another one. Another one. To your side here, deep breath in. This side. Good. Any pain or tenderness in your back area at all?
No.
Okay. All right, and I'm going to have you take some deep breaths in and out, in, out, in, out, in, out. Good. Couple more in. All right. I'm going to listen to your heart tones, okay? I'm going to listen to that with the bell of the stethoscope first. You can breathe normal for this. And again, I would normally be listening with skin-to-skin contact, but in this circumstance, we're not. So listen to this portion and continue to breathe normal. Okay. Can you lean forward for me too? Good. Okay, everything sounds good. Your lungs are clear. I don't hear any wheezes or anything like that. Your heart tones are regular. You have a good heart rate. So next I am going to take a peek at your rash. You said you have one on your thigh?
Yeah.
And the other one is about by your knee area?
Yeah.
Okay, so I'm going to take a look at the one on your thigh first.
Okay.
So I'm going to just take a peek. And I notice that it is round and annular. Okay. Look at this one on your knee. Okay. And I'm going to take a little lab sample.
Do you think this is going to be an issue for me at work? I work in the food industry. I work about 15 hours a week.
Okay. Well, as long as you take proper precautions, wash your hands, keep the rash covered, things like that, I think it would be okay to continue working.
Thank you.
Okay. All right. So I'm just going to take a little quick lab sample. Okay. So just a quick little wipe here. I'm going to put it on this slide. And then I'm going to take a little lab sample of this one over here on your thigh, put it on the slide.